Hi, my name is Melissa Herzog, and we are doing the dissection of the sheep's heart. This is the heart right here, and this is sort of how it sits in your chest wall. This is the apex of the heart. This is the anterior side of the heart, and this is the apex. And the base would be right through here. We have the left and right atria, which in order to find, you have to find the auricles. So I have a left auricle here and a right auricle here, and these auricles are part of the atrial chamber, so they fill up with blood. So these are the auricles, and this is how you know where the atria is. We also have, let's go back a bit. The left atria has oxygenated blood, and the right atria has deoxygenated blood. We also have the left and right ventricles. The left ventricle is going to have oxygen-rich blood, and the right ventricle is going to have oxygen-poor blood, and that's where it's going to pump out blood to the pulmonary trunk, which is right here. Right here is the pulmonary trunk. And then it's going to send blood into the pulmonary arteries. And they will carry the blood to the lungs for gas exchange. So after we look at the pulmonary trunk, we'll look at the interventricular sulcus, which would be right through here, and that interventricular sulcus would have the anterior interventricular branch of the left coronary artery running through it. And it is also where the septum between the left and right ventricles is located inside of the heart. Again, let's go back to the aorta. This is the aorta. This is the ascending aorta, and usually it'll have an aortic arch that will arch this way. And forking from that arch would be the brachiocephalic artery, the left common carotid, and the left subclavian. But in this specimen, it's been cut off, so you won't be able to see that. We'll turn it around to the posterior part. We have the vena cava here. This is the superior vena cava, and right here is the inferior vena cava. I'm not sure if you could see that, but that's the inferior. Let's see. The coronary artery or vein has a area where it collects blood from the heart that's already been used, and so it's oxygen poor, and it goes into the coronary sinus, which I believe that this is the coronary sinus right through here, because it looks like it runs down into the right atrium, which is where oxygen poor blood would go. Let's see. At that point, the deoxygenated blood will go back to the lungs, be pumped down to the right ventricle, and then come back up through the pulmonary trunk and be taken to the left and right lungs for oxygenation and gas exchange. And that is the sheep's heart. Thank you.